that we've learned. Now the anteriors, if you hold it up with the toe towards you, completely perpendicular to the floor, you can look at the shank and it's straight. So that's going to tell you that it's for the anteriors. That's one thing that's going to tell you. Now, if you look at with the toe towards you, there is one side that's higher and one edge that's lower. These are curettes. They only have one cutting edge. So one is a cutting edge and one is not. The lower edge, the one that is lower, is the cutting edge. Okay? The lower side, the corner, the cutting edge that is lower, the side that's lower is the cutting edge. Okay? So, the advantage of a Gracie curette, because it only has one cutting edge, you will cause less trauma to the tissues, as opposed to what we've been doing so far with the universal and the sickle. They've had two cutting edges, but the Gracies only have one, and of course that's going to go towards the tooth. So the cutting edge always goes towards the tooth. Now you have what's called a gingival curettage and an unintentional gingival curettage, and that's when you have the cutting edge towards the tissue. Now, there is something that you do called the gingival curettage where you get rid of the necrotic or dead tissue, but that's in advanced instrumentation. And you really don't even do that anymore. We use lasers as opposed to gingival curettage. Okay, so remember how we divided the midline in half? And we start on the other side of the midline? I guess I'm going to have to. So you will go on the other side of the midline with the cutting edge towards the tooth. Again, you'll use an assessment stroke until you come to calculus. Then you'll apply lateral pressure. Boy, this is dull. Divide the surface into 3 areas. There's a big difference between the push and the pull stroke. You go all the way up as close as you can to the contact. Then you'll go to the next tooth, start on the opposite side of the midline. Now you can see I'm fulcruming on the tooth, next to the tooth I'm working on. Yes?
Are you just in that position for this instrument or for demonstration?
I'm sorry, what?
Are you just in that position for this demonstration?
Just for the demonstration right now,
okay,
so that I can.
We would be at 9 then still.
Yes,
Right.
I mean if I'm over here, my hand is in the way.
Yeah.
Okay.
Yeah.
But thank you for bringing that up, because it's still the same rule of surfaces towards you at 9, surfaces away from you at 12. Maybe if I do one on the maxillary, I can you see? Okay, here, let's get this focused. Okay. Yeah, you can, I bet I, maybe, yeah. Okay. So here I'm doing surfaces to the patient's right, starting using an assessment stroke, rolling the instrument as I go by, and all the way up. And then I'll do the same thing here, opposite side of the midline. This instrument's so dull you can't even get white out of. Okay? So I did surfaces to the patient's right facial, surfaces to the patient's right lingual. I'm gonna sit at 12 o'clock and I'm going to do surfaces to the patient's left, surfaces to the patient's left facial, flip it, get my mirror out, and do surfaces to the patient's left lingual, cuspid to cuspid. Then, guess what we're gonna do? Horizontal.
Mr. Will, is that the same side or did you flip? I'm sorry.
I was over here and then I flipped and did that.
Flip the instrument.
I flipped it.
Yeah.
Because don't forget, it's a lot easier to determine the cutting edge because there's only one
Yeah.
and it's always the lower.
Are we still doing 70 to 80 degrees?
Oh gosh, to be quite honest, I don't remember what the angulation is. No, I think it does it for you. Okay, if the lower shank, which the lower shank here, from here to here, if that is parallel to the surface you're working on, it's automatically the correct angle. That's why the angle is low, the one side is lower. So it does it for you automatically.
You still use the one there, or just?
You still use the 1/3 the end. From the toe, 1/3 of the way up.
So not the side then?
Not the middle, it'll be the side,
And keep it
but the
parallel.
1/3, like,
Because it's already tilted.
like the side of it here to here.
Okay.
Not here
Right.
and not there.
Do you still have to worry about entering it at a 0 degree?
You still have to enter as close to 0 as you can get. But it's actually a little bit easier because you have that angulation already.
Yeah.
But still, in the posteriors, you won't enter at 0. Well, pretty much anywhere you don't enter at 0. You just enter as close to, you close it. You want to close it. And see that distinction. So any questions about the 5/6?
This is for sub and supergingival, or only?
Usually just sub,
Okay.
but you can do supra.
Okay.
But for comps, we'll just do sub.
Okay. And how far down can we go?
To the base of the pocket. You go all the way down on this one. Because you have a toe, you don't have a tip. And the shanks are made so that they can go deeper. Now, you also have, for deeper pockets, an instrument called the extended shank, and that shank is even longer than a regular rigid. So you have, there's rigid, there's extended rigid, there's extra rigid, there's, and then there's minis. You also have minis. So if you look at the size of this blade, the minis go to about here. It's about that size. They're really small. Actually, I think I saw a couple minis over here.
We have it.
You have some minis.
Did she say that this was for arthritis?
So can you see the difference here? Not, those aren't the macro mini, there's minis and then there's macro minis. But you can see this one is a little bit bigger than this one. And then there's one that's smaller than this, the macro mini. This one actually started out bigger, but it got sharpened. So now it's kind of a small regular one.
These instruments are for hard calculus?
Yes, these are for medium to hard calculus. And you can use these on light calculus too, if the tissue will let you in there. But yeah, this is a workhorse for you. Now it's not quite the workhorse as a sickle, but it's more of a workhorse than the universal. Okay? Questions on the 5.6? Okay, pretty straightforward. Now, I'm going to show you the difference between the 5.6 and the 7.8. And you will get to see, just from looking at your chart or just looking at your cassettes, very easily the differences between these. So what do you see the difference between the 5.6? This is the 7.8 right here. What do you see the difference of the 5.6 and the 7.8? The angle. Exactly. So the angle is sharper and smaller, not larger. See the length of this? This one is supposed to be that same length. See how this got sharpened shorter?
Yeah.
So this is a good 7.8. Now, the 7.8, because of the length of that shank and that angle, you use on the posterior teeth. You use them on the straight buccal and the straight lingual. So, you determine the working end the same way. Hold it perpendicular to the floor, toe towards you. There's one end that's lower than the other, and the lower end is the cutting edge.
70.
It doesn't show up on here as lower. But if you look at it, you can see that there's one end that's lower than the other.
And this will still be B to the D, correct?
Yes. B to the D. And this is for the straight buccal and the straight lingual. This goes from line angle to line angle. Toe down. So you're going to insert it close to 0 as you can. Start just behind that distal line angle. And here's where you're going to use your oblique stroke. On the trunk, not into the furcation. On the trunk.
Do we do horizontal with this one too, or no?
May I what?
Do we also do horizontal stroke? Or only oblique?
Usually, well, you could use a horizontal stroke in there. But you're going to get the horizontal with your 13, 14, so it's not necessary.
So this is only for oblique.
This is for buccal and lingual. It's the straight buccal and lingual on the trunk. You go to just behind the line angle, and your fulcrum moves as you move forward on the tube. Ouch. You okay?
No, I didn't hurt myself.
And then you go to the other line angle, just past the other line angle.
And strictly oblique stroke, you said?
Strictly oblique.
Not horizontal.
On both buccal, flip it, and lingual. toe down.
Is this only used on the molars or also premolars?
And premolars,
Can you repeat that?
all posteriors. Now, the same thing happens here that it did with the universal in that the premolars are real thin, so you may only get 1 or 2 oblique strokes in there. Yes,
I got a little confused. Okay, so when we're doing the horizontal stroke,
don't worry about the horizontal stroke
oh,
right
you
now.
said don't worry.
You can do it, but we're gonna get that with the 13-14.
Okay, sorry.
Let's not complicate it, let's just do, oblique. Oblique only.
So we're inserting with the toe down just behind the distal line angle, coming in with oblique stroke.
Perfect.
Okay.
Buccal and lingual posteriors. Questions on the 7-8? Okie dokie. Now, let's do the 11-12. Now what you need to do is hold the lower shank, not the instrument, because now we have a complex shank. Up until now, we just had a straight shank. Now we have a complex shank. So now look at that lower shank, which is from here to here. Here, maybe do it down here. So can you see that complex shank? The lower shank from here to here. So you need to have that perpendicular to the floor. Find the lower side of that, and that's your cutting edge. And remember, it's always the cutting edge goes to the tooth. Go towards the tooth.
The one that's lower to the floor.
The one that's closest to the floor. So it would be the outer edge. So the outer edge is the cutting edge.
And this is for only posterior?
Only posterior, only mesials of the posterior. So I hadn't said that yet. So now watch this first, okay? So now you're going to start just distal to that mesial line angle. It's hard with this camera in the way, but you roll, you do a vertical stroke, you go interproximal, keeping that tip adapted, and you divide it into thirds up to the contact. So you start just mesial. Okay, here's calculus. Up to the contact. And then you would flip it. You would start just distal to that mesial line angle. Go interproximal at least more than halfway. And you come up.
For the distal line angle, we start mesial to the distal line angle.
We haven't talked about the distal line angle yet. This is a mesial instrument.
Just a minute.
So then,
This is only for the mesial surface.
okay, so
Is this still the
mesial,
You start distal
distal to the mesial?
to the mesial line angle.
Is it still the
Oh,
mesial?
start distal.
Yeah.
Yeah.
Mesial.
Start distal.
Yes. Still V to the D.
Can you do the stroke one more time?
It's 11-12. Yes, it's 11-12.
So I'm starting just distal to that mesial line angle. roll that instrument. And keep that lower shank as parallel to the long axis of the tooth as you can get it. And if that lower shank is parallel to the surface, you have the correct angulation.
The lower shank is parallel.
If the lower shank is parallel to the surface you're working on, you have the correct angulation. Did you guys hear me?
Yes.
That makes a difference.
Did you guys hear
I
me?
didn't
No.
hear you.
If you have the lower shank parallel to the surface you're working on, you have the correct angulation. So the lower shank needs to be parallel to
The long axis of the tooth.
the surface you're working on.
Is that in regards to all of these? Or just
Yes.
Because it's slanted, so it's already doing the angle for
It's
you.
doing it for you.
Mhm. That's nice.
So if it's parallel to the surface you're working on, you are at the correct angulation. Okay? And these are for sextants 1, 3, 4, and 6. The posterior sextants.
Molars and premolars.
Hmm?
Molars and premolars.
Mm-hmm. Now, do you remember how we fulcrumed on the top for the premolars? You can do that here. So you can fulcrum on the top. It works very, very well. You can get good lateral pressure. Fulcruming on the top for the premolars. And again, usually you can sometimes get the mesial of that first molar if you fulcrum on the top for those mandibular premolars.
It's only mesial.
Sometimes you can get a good angle with the mesial of the first molars. You can go back that far, but you usually can't get a good angle for the rest of them. Okay?
But you're only using this on the mesial surface.
You only use it on the mesial surface.
Yeah.
You only use it starting at that line angle, just on the other side of that line angle, so you're overlapping the line angle. So 11, 12 is mesial surfaces only. Questions? Okie dokie. Now we're going to do the 13, 14. I don't have a good 13.
Split grasp. I said split grasp.
This?
Practice.
Would it be in this kit? 'Cause I got my red.
Yeah, if you have, do you have two?
Keep this together.
I don't know if they're the same.
You just took
thing.
There should be this.
Glue them together. I do it all the time.
His fingers starting to move.
I just need it back.
Don't let me forget. I'll try not to ruin it for you too. Okay, so now the 13, 14. Again, have the lower shank perpendicular to the surface with the toe towards you. And there's one edge that's lower than the other edge. That's the cutting edge. And that's what's going to be close to the tooth, not the tissue. Because you don't want the cutting edge on the tissue, remember? Okay, so now we're going to do the distal surfaces with the 13, 14. This is an extended shank. This is the blue. This is in your perio kit. I don't think the green shank is as long as the kit in your, the 13, 14 in your green kit, I don't think is extended shank.
No, it's not.
but this is your perio kit that I got yours from. So when I hold this up here, it's gonna be a little bit longer than yours. So toe towards you, lower edge towards the tooth. Now here, you're gonna start just mesial to that line angle, vertical stroke, divide that distal surface into thirds. Keep that lower shank as parallel as you can and go up to the contact.
So it's still D to the V.
Still D to the V. Okay, now I'm gonna go one step farther. Do we have that? Are we all on the same page?
Can you do it one more time, please? You have a loose tooth?
I do. That doesn't have, we didn't, I had to give this screw to somebody. Oh, who's missing a tooth?
Remember it was.
Yeah, I think I've got it. Do you still have the screw?
Okay.
Bring that screw, next week,
Okay.
cause I have a tooth for you.
Oh, okay. Thank you.
Okay, so are we all on the same page here? Any questions?
Could you check mine really quick?
What?
Could you come and check my, one really quick? I don't know if I have it on the right side. I'm a little confused.
So it's B to D.
Just like that, you just do it.
This is the lowest.
Yeah.
That's the lower. But then, that doesn't make sense. So this is the lowest tooth on the legal side. Is it just like
B still to the D.
Yeah. Yeah, well, yeah.
B still to the D.
Cause this is, I understand the lower, right? And it's B to D.
Well, that's correct. Are you talking about like the zero?
Yeah.
You said posterior, you're kind of forget about that.
Like this is like.
Oh no, this one's different. This one, the lower side is on this side.
How, why are you holding it tight?
Because when you're holding it, this should be like straight, like perpendicular to the floor.
What,
So are we all on the same page as far as the cutting edge?
So the basically lower edge.
Yeah.
Always the lower edge, yeah.
I think I like these ones better than the universal already.
Yeah.
Well, if you get the universal, these are basic.
I feel like I haven't quite got the universal and I already feel like more confident in these almost.
That's a good thing because you're gonna be using these more. Okay, but I need to add something, you guys, so whenever everybody's ready to move on, let me know.
Ready?
Are you guys ready to move on?
Yes.
Okay, so now we have done this. We're here. Now we flip it, toe down, like we did with the Explorer, and we're going to use the horizontal stroke on that line angle. And we go just behind the line angle to just in front of the line angle. So there's your horizontal stroke.
And starting at the base.
Starting at the base, moving towards the crown. Okay?
Can you show that again?
I'll show you the transition. So here, I'm just mesial to that line angle. Flip it. Toe down. And now I'm going just in front and behind that line angle coming up.
And would this also apply that you can't go all the way to the base, or yes?
You can go all the way to the base on this one. But you start at the base and come coronally.
Does that look like a little board?
Okay.
But you
Questions? Is that enough, do you think, to get you started? Yes.
When we use these, do we like start with the 13, 14, like the sextant, like? the
You
sequence?
always start with the most distal surface. So yes, you always start with the 13, 14, 7, 8, 11, 12, 5, 6.
Would you do all of the distals first, or would you be flipping for each two? I mean, changing your instrument for.
You do, the way that I recommend you do it is you do all of the do all of the distals, and then flip it and do all the horizontals on the buccal surface.
7, 8.
Then do all the distals on the lingual, flip it, and do all the horizontals on the lingual. So you use that to completion in that sextant. Then you would do your 7, 8, buccal and lingual to completion. Then you would do the 11, 12, the mesials, buccal and lingual to completion. So you don't pick up for this buccal surface here, you do not go 13, 14, 7, 8, 11, 12. You don't pick up 3 instruments before you move on to the next 2. So you would do all the distals, then all the okay? What do you need? Okay. How are we doing? Does this get you started?
Yes.
Hmm?
Yes, thank you.
So for the comp, you're gonna get those services.
For the comp, okay, this is a good question, you guys. How's the comp gonna go? It's gonna go exactly the way that the others, because I use the same tongue depressors. So I will have like 2 posteriors and 2 anteriors. So you're gonna need to be able to choose what instruments you're going to need.